Hello everyone, I'm urologist Omar Erdamakaya. The subject we will talk about today is the male infertility method, that is, vasectomy. To explain the vasectomy simply, it is an operation performed by tying and cutting the sperm ducts coming out just above the testicles in the bag and preventing the sperm from going to the semen. The aim is to purify the semen from sperm, eliminating the connection of the sperm pathway passing through the testicles. This is an easy operation that can be done in about 10 minutes with local anesthesia. Within 3 months after the sperm ducts are connected, the sperm is no longer mixed with semen. In other words, the semen is now sterile, that is, it is purified from sperm. What are the advantages of this easy method? It is cheaper and simpler than infertility surgery to be performed on the female partner. In women, this operation is more serious because women's tubal tracts are inside the abdomen. It is usually recommended to be done during cesarean surgery. Or this operation can be performed by opening the abdomen or entering with a laparoscopy in women. Other than that, the success rate is 100%. Well, the risk is low, and as I said, after this surgery, you are free from using condoms. If you look at the complications, it has very rare complications. It can cause bleeding, sometimes it can clot, it can cause bruising and swelling in that area, or it may have the possibility of infection. Apart from that, it does not reduce your sexual performance. It does not permanently damage any penis, it does not cause cancer, or it is not an operation that will cause severe pain. The most important detail about vasectomy is that after these ducts are cut, if you decide that you want to have children, it is really hard to return from this. They can stitch these 2 ducts together again with microsurgery for the return, but the success rate is very low, lower than 30%. Patient histories are usually as follows. Let me tell you about an example of my patient. The patient got married, and after 2 children, his wife no longer wants to use the contraceptive pill method. Because these birth control drugs are hormonal drugs, she doesn't want to use them. Also, she doesn't want to have surgery. They think and talk, and learn that male surgery is easier. So his wife wants him to have the surgery. And the patient undergoes a vasectomy operation. A few years pass, they don't get along and they get divorced. After the divorce, he marries another woman after a certain period of time. The woman is young and wants to have children, and the problem starts here. This operation can be done here, and then you have to wait for months for sperm to come. But some of the patients have in vitro fertilization instead of having this operation. In vitro fertilization, sperm is taken from the testicles. It is another operation. This is how in vitro fertilization is done. But this is a more troublesome procedure. Actually, it makes sense to have this operation in some cases. Let's make an assumption. Let's say you are 40 years old and you have had your children, the children are growing up and you don't want any more children. And you don't have a stable relationship. You have different partners and you don't want children anymore. Then it makes perfect sense to have this surgery. But we do not recommend vasectomy if you have even the slightest possibility of wanting to have children one day. This is an important detail. Other than that, vasectomy is an easy operation. I shot this video for this article. If you want to watch my other videos, you can subscribe to my YouTube channel. Thank you for listening. Best regards.